Okay, we're going to go through now some common causes of hair loss, and we already know a couple of them because I mentioned one of them, which is age. It's happening to me. So, doctor, that's number one?
Sure. So age and heredity are kind of combined because we know 20% of men in their 20s, 30% of men in their 30s are going to see male pattern hair loss. So receding hairline, we're going to see bald spot happening in the crown area, and then it's going to continue to grow over time until you can lose all of your hair.
Diseases also, medications can do it. Stress,
sure.
We talked about that. Low protein diet. Family history is another big one.
Right, so that's the genetic component. And of course, if you're nutritionally deficient, you're not going to grow good hair. So it's really, really important to maintain good, healthy nutritional supplementation as well as good protein intake and caloric intake if you're going to grow healthy hair.
Right. And
so stay away from those. So crash diets this time of the year is a big factor. That can trigger some shedding. If you're losing, let's call it just 10 to 15 pounds, let's say, in a relatively short period of time, maybe 6 months or less.
That's going to have an effect.
Yeah, it's going to affect your hair, your skin, and other things too, but certainly your hair follicles are susceptible